Good evening, everyone. NCD is a very interesting topic because of NCDs is a world's leading cause of death, as we know, and we are doing so many awareness program along with the adolescent school student in the schools, and even if we are doing the colleges also. So we thought we will share the findings of our organization, whatever data we have collected. So I wanted to talk about that. So my topic is NCT risk factors among adolescents of West Bengal, findings of the day students awareness program. So let's start with the numbers. The non-communicable disease, the NCTs kill around 41 million people each year, equivalent to the 74% of all the deaths globally. This data collected from the WHO. Each year, 17 million people die from NCTs before the age 70. 86% of these premature deaths occur in the low and middle income countries of all the NCT states. So around 77% is from the low and middle income countries. The current global burden is the cardiovascular diseases account for most NCT deaths, around 17.9 million people annually, and followed by the cancers and the chronic respiratory diseases, and diabetes is around 2 million, which are the included the kidney disease death caused by the diabetes. And we can see this chart. There the four groups of the diseases account for around more than 80% of all the premature NCT death. Next, please. Tobacco uses, physical inactivity, the harmful use of the alcohol, unhealthy diets, and the air pollution. All these things increases the risk of dying from the NCD. Detection, proper screening, and the proper treatment of NCDs, as well as the palliative care, are the key components of the response to NCDs. For these particular things, we have changed our focus to the not only from the diabetes to all the NCDs. We are now creating the awareness. We are running the screening program and everything. Next slide, please. So let's see the list of the NCDs in India. Cardiovascular or heart diseases, cerebrovascular diseases or the stroke, hypertension, the diabetes, common cancer like the cervical, breast, and the oral cancer, chronic respiratory diseases, non-alcoholic fatty liver disease, tooth decay or the cavities, and gum disease, etc. Next, please. Next, please. Yeah. Let's see the burden of India. What is the NCT's burden of India? In 2016, 54.5 million people in India had the cardiovascular disease, 55 million had the COPD, 38 million had the asthma, and 65 million had the diabetes. But in 2020, the National Cancer Registry Program reported that there were 13.92 lakh cases of cancer in India. So gradually the number is increasing. Next, please. The National Family Health Survey found that around 24% of the women and 22.9% of the men aged between 15 to 49 are the overweight or obese. India accounts for more than 2/3 of the all NCT-related deaths in the Southeast Asia region. That data comes from the WHO. Next, please. So let's see which are the risk factors of NCDs. So we can divide into the modifiable behavioral risk factor and the metabolic risk factors, such as like the raise the blood pressure, overweight or obesity, hyperglycemia or hyperlipidemia, etc. And modifiable, all the diabetes educator and the nutrition, we know that the tobacco uses, the inactivity in the lethargic lifestyle and unhealthy diet, and all these are the very increase the NCDs. And other risk factor like the environmental risk factor, like the air pollution, all these things can increase the NCDs in India. Next, please. Let's see what are the prevalences of the risk factor of NCDs among the adolescents in India. According to the survey by the National Non-Communicable Disease Monitoring Survey of India, adolescents in India are at a high risk of developing non-communicable diseases. Some of the risk factors we have already discussed earlier, like the tobacco. 1 in 10 adolescents have experimented with the tobacco, and the intake of tobacco is stretched. The number of adolescents, intake of the tobacco uses is gradually increasing. Tobacco, it can be different types. I think no need to mention what kind of tobaccos, as we are all the healthcare provider, we know about that. And physical activity, 1/4 of adolescents are not physically active enough. Because of maximum, they are busy with the screening time, with their laptop, with their tab, with their phones, and everywhere we can see. Next. Weight, around 6.2% of adolescents are overweight. Nearly half of adolescents eat the salted, the fast food, the snacks, and at least once in a week. Other risk factor like consuming the packed foods or inadequate fruits and vegetable intake, extra salt, visible or invisibly, and the alcohol consumption. All these are the risk factors. So, uh, from our organization, Diabetes Awareness and Youth, we conducted the awareness program in school and colleges everywhere, and still we are running. So we have started this student awareness program in the year of 2011, and we have changed our focus in 2018 on the NCDs for the broader aspects. And we have already reached more than 12,000 students since 2011. And the finding which I am going to discuss today, it is based on the program held from July 2023 to October 2024. And the Hollows Healthcare Foundation, it was our cause partner of this program. So I have mentioned already the timing period. And we in this period, we have visited the 14 school, and total participants, we have taken 1,060. Area was Kolkata and South 24 Parganas in West Bengal. And demography, we have taken urban and the rural, both the places, and age group between 15 to 21, male and female both are included. And we have main outcome measured possible causes behind the NCD risk factor for adolescents, so that we can try to, if we can understand what are the possible causes for the NCD, so we can help to prevent, we can help to well manage the NCDs and everything. Next slide, please. So as you can see in my right side of the screen, these are the questionnaire which we provided to the students of the school and colleges to fill up this questionnaire, and we have analyzed the data from this questionnaire data. So around 543 out of 1,060 students have at least one NCD in their first degree relative, and 107 students have diabetes in their family. 252 participants have diabetes and the heart diseases in first degree relatives. And 16 students' family have COPD or asthma patient. 11 participants, around 1% have the cancer, and less than 10 participants have stated that they have the thyroid patient in their family members. 437, around 41.2% out of 1,060 students thinking that eating too much of carbs and high calories food, junk food, all these things can increase their blood sugar and it can cause the diabetes. But rest of the numbers, they doesn't have any idea how come the diabetes can occur and what can be happen if they take the lots of carb and the high calorie or junk foods. 317 students have stated that they may have diabetes. If it is there in their family, rest I don't know or think otherwise. 647 participants think that the diabetes can be prevented by modification of lifestyle, including the diet. And 301 students knows that routine blood sugar check is important after 30 years of age. Out of 1,060 participants, from urban, we have taken 461, from the rural, 599, and out of them, male was 368 and female 692. Next, please. Yeah, out of urban, 124 male and 337 female has been taken. And out of the rural, 244 male and 355 female has been. And we have seen the underweight around 3.1%, overweight around 3.1%, obese 11.3%, overweight and obese 14.7%. We have taken male total 28.8%, female 71.2%. So what we have seen, 52 among the 156 overweight and obese students think that they have the normal weight or BMI. Why so? Because they doesn't know about what is called the overweight and what is the obese. In our state in West Bengal, if we look like we said in Bolumolu, like if we looks fatty, it means we are the perfect in weight. And if we looks like the well and fit, so the people say, okay, so you are underweight or you are under nutrition. So the normal, the social needs are there. So every mothers and every family members used to give their children before going to school only the rice and the potato. So in Bengali, we call the alu bhate bhat. So this can leads to more weight and leads to obese. And 25% among the 156 have stated that they don't do any exercise or decline to share their habit of exercise, but confess that they do play mobile game or computer game or watching TV only. Average screen time is more than at least 3 hours per day. 117 among the 156 have stated that they do outdoor activities, but 83 have specifically mentioned that they do the outdoor activities like the playing football and cricket, swimming, etc. 83 out of 156 have regular outdoor activities and 29 among them have less than 30 minutes activities. Thus, 29 out of 156 have physical activities more than 30 minutes daily. 8 out of 156 overweight or obese students are vegetarian and rest 148 are non-vegetarian. 33 out of 156 have stated that they usually take outside food as evening snacks, and 37 out of 156 have informed that they consume junk foods 3 or more days in a week. So from all these findings, we have concluded in a one place. That is, it may be concluded that prevailing the unhealthy lifestyle, including the consumption of junk foods and physical inactivity, which causes the risk factor for NCDs among the adolescents in both the urban and the rural population. As you know, NCD not only affect the urban or rural people at any age, any kind of people, and any groups and any region. That doesn't matter. But the silver line is that the awareness. Can you? Yeah, previously. But the silver line is that the awareness level about the prevention of NCD, especially diabetes, is significantly increases due to the efforts from different stakeholders. But main problem is the more penetration is needed for converting the knowledge into action, which is lack. And we need to focus in this place more and more. We, behalf of DAY, is consistently striving to achieve that milestone by adopting new initiatives on the basis of the findings of the present study. Next slide, please. For prevention of diabetes and gestational diabetes mellitus, we launched our slogan in 2009. Annually test blood sugar once 30 plus UR in Bengali. বয়স হলে 30 বছর ব্লাড সুগার টেস্ট প্রতি বছর, উম্রে হে 30 সাল মধুমেহ কা जांच हाथ साल, and positively test blood sugar once pregnant you are. গর্ভবতী হলেন যিনি দেখতেই হবে তার চিনি, গর্ভবতী আগার ও মধুমেহ কা जांच जरूर करो. Next slide, please. So please visit our pages. These are the links. Please follow. Please contact us. Please make us encouraged to do more and more work in the field, and we will feel so supportive. I am requesting each and everyone, each the participants. We are really doing the hard work to for the prevention, for managing well in the NCDs. Please follow. Please connect with us. Next, please. So our philosophy and appeal is, let's begin with coming together and let's progress with keeping together. And definitely when we are together, success cannot be better. Success definitely is there. So thank you, each and everyone. Let's work with us to foster a diabetes of our society and aid a healthy years to life. Thank you very much. Thank you, each and everyone.